So nervous system. You need to know the two divisions of the nervous system. It's up on the board there. And I don't know if I sent it to you in the notes. I don't think I did, but anyway. So first division is known as the CNS, which stands for central nervous system. Know what that one is composed of? It's composed of the brain and the spinal cord. Okay, the second division is the PNS, which is periphery, everything on the outside. Peripheral nervous system, composed of 12 pairs of cranial nerves and 31 pairs of spinal nerves. Okay, the basic nerve cell or neuron. Okay, you need to know what that is composed of. It's composed of number one, the cell body itself, and oh, which reminds me, that picture, the nervous system of the little nerve cell, that's going to be on your test. Yes. Okay. You'll have to label. Okay, so cell body, the next part of the basic neuron is the axon. Okay, the axon is the part that leaves the cell body. So it's the extension that leaves the cell body. There's something called the myelin sheath, and that's just the fatty covering of the axon. It just increases the transmission. Okay, myelin sheath is the fatty covering, and it increases the transmission of the impulse. Okay, the dendrites, those are extensions that go to the cell body. Axon leaves, dendrites go to it. Okay, you need to know the specialized types of neurons or nerve cells. The first one is the afferent, also known as the sensory nerve. These conduct impulses from the periphery to the CNS. Okay, the efferent or motor nerves, they conduct impulses from the CNS to the periphery. Kind of like if a mosquito is biting you, you feel it and then you hit it. So afferent is first, efferent is second. That makes sense. Okay, and then it goes into on your little chart. If you want to take out your chart, infections of the CNS. And if I don't say it, it's not going to be on your test. Okay. See it? Infections of the CNS first. Okay. First one is meningitis. This is an acute inflammation of the meninges. Need to know the two types of meningitis. Everybody have it? No? Does anybody have it on their chart? Yeah, it's on the first part where the little picture is, the very first section. Yeah, right below that is what I'm talking about. Meningitis.
I see meningitis, but there's not two types.
Really?
Bacterial or viral?
Oh.
In the middle section of the condition.
Oh, is that the two types?
Yeah.
Oh, okay. I was looking for bullet points there.
Oh, okay.
Sorry, you're looking for two points.
Yeah.
I know.
Okay, so the two types, and it's just what's giving them meningitis. Bacterial is from a bacteria, and the viral meningitis is from a virus. Usually the viral is from herpes, but don't worry about that. Okay, diagnosis, you need to know it's made with a lumbar puncture. You guys know that. So they take some fluid and they check it. Don't worry about encephalitis, that's just an infection within the brain. Okay, then we go into tumors of the CNS, right? Okay. First one is known as a glioma. This is the most common primary malignant brain tumor. Okay, I put down two common types. You're gonna have to name them and describe them on your test. The first one is a glioblastoma. Just know that this is highly malignant. And the second one is an astrocytoma, which is a slow-growing one. Sometimes forms these large cavities.
You said we have to write these out?
Yes, you do. So you need to write them out and name them. Name them and describe briefly what they are. Okay, the next one is something called meningioma. This is benign. Know that it is benign, and it arises from the arachnoid cells. It usually attaches to the dura mater. You guys remember your different layers of mater? That was from special procedures last fall. What's the dura?
The hardest.
Good, the harder outer one. Okay, good. All right. Okay, the next one is an acoustic neuroma. This is a slow-growing benign tumor. Acoustic, so usually it originates in the internal auditory canal. Okay, pituitary adenoma. This one is usually benign, and it's a tumor of the pituitary gland. Okay, next one is the craniopharyngioma. This one is a benign tumor. It usually originates above the sella turcica.
You know that it's cystic.
Just know where it originates. Okay, vascular diseases of the CNS. Okay, first thing is something called a CVA, which is a cerebrovascular accident, which is known as a stroke.
The hemorrhagic stroke?
Two types. There's two main types of strokes. Number one is a hemorrhagic, which just means that a blood vessel burst, hemorrhaged. Bless you. And the second one is an ischemic type, which just means that this one is a blood clot in a vessel of the brain. Okay, so the first one is a vessel that burst. The second one is a clot. Okay, typical sites for thrombus formation. You need to name two of these for your test. Okay, first one is the bifurcation of the common carotid artery. Second typical area is the bifurcation of the internal carotid. You guys You're gonna have to name two of the three. You guys remember the internal carotid bifurcates to what and what? That was a long time ago. Anterior and middle cerebral. Wasn't the same. I didn't teach it, you guys, online. Okay, and the third typical area is within something called the carotid sinus.
So out of these, we have to name those two?
Two.
And we just write it out?
Yes.
Okay, thank you.
Okay. The next two things you're gonna have to write out on your test. TIA stands for transient ischemic attack. Those are known as mini strokes. Okay, they're usually, don't worry about it, they're usually minor and nothing usually happens. Okay, the second type of is an ischemic stroke. Those are the big ones. They're usually preceded by a TIA. Okay, the temporary ones usually resolve within 24 hours. Okay, all right, we're gonna move on to multiple sclerosis. Multiple sclerosis is a chronic progressive disease of the nervous system. It commonly affects people between the ages of 20 and 40. MS usually affects more women than it does men for some reason. And it involves degeneration of the myelin sheath that we just kind of talked about. Okay, radiographic appearance of MS. There's plaque or white areas that develop, and sometimes they form scar tissue or sclerotic lesions. MRIs are best for showing these. You don't have to write that down. Okay, epilepsy and convulsive disorders. Okay, epilepsy is a condition where the brain impulses are temporarily disturbed. Okay, you need to name the two types for your test. Number one is something known as a petite, just think of little, petite mole. That's the mildest type. Usually kids get these, and it's just a brief episode of a seizure. Okay, the second type is the grand mal. That's the general convulsions that you guys always hear about. Patient falls to the floor, foams at the mouth. What do they say to do when that happens?
Clear everything away.
Just clear everything away. Let them do their thing. Don't try and stop it. Okay. All right. Degenerative diseases is the next thing. Alzheimer's is the first thing. Note the other name for Alzheimer. It's presenile dementia. It's when there's progressive cerebral atrophy. So it develops at an early age than when it normally does. What's atrophy?
And the muscles die.
Yeah, kind of shrinking. So with these people, their cerebrum just kind of shrinks where it usually shouldn't. You know, they're not that old. I want you to know, you need to know the radiographic appearance with CT and MR. It just shows that. It shows cerebral atrophy. And since the cerebrum is smaller, the ventricles are enlarged. Okay, so cerebral atrophy with enlargement of the ventricles. Okay, the next one is Huntington's disease. Know that this is an inherited condition, usually involves men. Okay, that's it for that. Parkinson's disease is the next one. This is a progressive degenerative disease. It's within the nerve cells of the brain. And know the characteristics of Parkinson's. Stoop posture, stiffness, and slowness of the movement, facial expressions, they're fixed, and involuntary tremors of the limb. This is like the Michael J. Fox disease. I think Muhammad Ali also had it. Okay, hydrocephalus is the next one. That is, hydrocephalus is dilation of the ventricular system. Radiographic appearance, you need to know, if it's a plain radiograph, you'll see separation of the sutures. They're just kind of split apart. Treatment for hydrocephalus, usually they put a shunt between the ventricles of the brain, either to the heart or the peritoneal cavity. You guys seen those shunts? Sometimes you do shunt studies at some places. If I put the different types of shunts, don't worry about it. Did I put it on there? No? Okay. Don't worry about the different types.
Where does the shunt go to again?
Either to the heart or the peritoneal cavity.
For epilepsy, the two types, the ones that we have to write out, do we just write out the names or the,
What they are?
yeah?
You have to do a brief description. Petit
Okay.
mal, just minor events. Grand mal are major events.
Okay, thank you.
Okay. Okay, evidently you guys, you have a handout for the hemo, I have a hard time saying hematopoietic system, which is your blood vessel system.
Yeah.
You have it? 3 basic types of blood cells. I said I wrote down that I put it on a handout. Okay, so you need to know the 3 basic types. The first one on your list is erythrocytes, which are red blood cells. Know that red blood cells do not have a nucleus. And they are formed in the red bone marrow. You're gonna have to write that out. This is not working.
In the red bone marrow?
Yes. Bless you. That's a baby sneeze. Okay, the next type of blood cell is a thrombocyte, which is known as a platelet. These are the smallest blood cells. They're responsible for clotting, blood clotting, and they are also formed in the red bone marrow.
You said they're responsible for clotting?
Yes, blood clotting. Okay, the last type are leukocytes, which are white blood cells. Know the 2 classifications. They can be classified as granular or non-granular, and they all have a nucleus. Okay, you're gonna have to name the types for me. The granular white blood cells are formed within the red bone marrow.
You said the granular?
Correct. The granular white blood cells are formed in the red bone marrow. You need to know the 3 types. Write them out: basophils, eosinophils, and neutrophils. Non-granular WBCs, white blood cells, are mainly formed in the lymphatic tissues of the spleen. And you need to know the 2 types, which should be on your handout. Lymphocytes,
These ones are forming the which bone?
lymphatic tissue, usually, of the spleen, most of them. Okay, so the 2 types of non-granular are lymphocytes and monocytes.
We have to write those out too?
Yeah. I'm not real big on spelling as long as it looks like you know what you're talking about. Okay. Diseases of red blood cells first. Everybody with me? one is anemia. Basically, I want you to know that anemia refers to a condition. It's not really a disease. It's a condition where there's a decreased amount of hemoglobin in the blood. Okay, anemic patient, it's best seen, we have this in patient care. Anemic patients, it's best seen if they're anemic, is in the mucous membranes of the mouth and the nail beds. They're kind of bluish. Hemolytic anemia is not on your test. Sickle cell anemia is. This is generally confined to African Americans, and it's where the red blood cells are crescent or sickle shaped, and they tend to rupture. Okay, now we go into diseases of the white blood cells. Okay, first one is leukemia. This is where the white blood cells are overproduced. There's an overproduction of WBCs. And I put down two types of leukemia. The first one is myelocytic leukemia. That one begins in the bone marrow. And lymphatic begins in the lymph nodes. Okay, radiographic appearance of both of those kind. There's bone marrow destruction. It looks like the moth-eaten appearance. Okay, next one is lymphoma. Lymphoma is a malignancy of the lymph cells. It's divided into two major types, which you're going to have to name. Number one is non-Hodgkin's, and the other one is Hodgkin's lymphoma. That's all you need to know. Non-Hodgkin's and Hodgkin's. Okay, don't worry about radiographic appearance. Okay, next one is infectious mononucleosis. That is a viral disease of the lymph system. That's all I want you to know about that. Okay, diseases of the platelets is the next one. Hemophilia is an inherited anomaly or disorder. It's where the blood doesn't clot. Any questions? We are moving on to endocrine system. So you're going to have a little bit of writing to do with this one, because I didn't put it on your handout. So I named the different types of endocrine glands, which when we get to them in the disease process, I'll kind of explain them just a teeny bit, basically where they are. So the endocrine system, I want you to know, it's responsible for metabolic activities. Through the release of hormones. Okay, endocrine glands are ductless. And they secrete hormones directly into the surrounding blood. And lymphatic systems. You don't have to know the difference between major and minor, but you will have to write out 6 of these glands. I don't care if if you know which one is major and which one is minor. So for the major endocrine glands, number 1 is the adrenal. Number 2 is the pituitary or hypophysis. Know that the pituitary gland is known as the master gland. It has so many different functions. Okay, the third one for major is the thyroid. And the fourth one is the parathyroid. Okay, minor glands, number 1 is the pineal. Number 2 is the thymus. 3 are the gonads. Number 4 is the hypothalamus. And the 5th one is the pancreas. Remember, pancreas can also be an exocrine, but we're just talking about endocrine. True.
Don't even call him, I already said that for my stuff. Come on.
We've been in the north before. Speak to that now. That's all you need to say. So we can take it.
Oh, so I'm guessing we're still finishing, we're probably on 24.
Sweet. Has anyone checked the dates for this, for the summer clinical classes? Does it go
It starts
through
like that.
around those dates?
It ends in 2020.
Oh, 2020?
24th of May, so May
Oh, okay. Now we can make that.
That's when it starts?
Yeah,
So I
like
guess
the
that's
second week of May, when you're officially done with the program, yes.
So we can go for the- Go get a cabin for-
If you don't have it with you, put it in my box, my mailbox sometime, or give it to a student by next Wednesday. All right, where was I? We went over the minor and major. You have to write out 6 for your test. Okay? I didn't put it down. Okay, so write out hypoactive glands.
Sound like a new category?
Hypo, H-Y-P-O, hypoactive glands. Because we're talking about the endocrine glands. This is inadequate production. Hypo, less. Okay?
Inadequate?
Inadequate, or not enough production of hormones. Okay, so what would the opposite be? Good, hyperactive glands. So this is too much production for secretion of hormones. Okay, a lot of these diseases or problems with the endocrine glands, it's either hypoactive or hyperactive. Okay. So the first one we're going to talk about diseases of the adrenal gland. First of all, you guys remember where are the adrenal glands? Good. They sit on top of your kidney. Okay. All right. The first one is Cushing's syndrome or disease. This results from a hypersecretion of steroids from the adrenal gland. Hypersecretion.
I'm sorry, can you say that again?
This is a problem with the hypersecretion of steroids by the adrenal gland. Cushing's syndrome.
Is this what they call the ugly disease?
Huh?
Is this what they call the ugly disease?
Kind of, they have this big moon face.
Yeah. My boss's grandson has it.
Really, the eyes bulgy.
Used to be so that the cutest kid,
I know, it's sad. Yeah. Okay, the next one is pheochromocytoma. This is a tumor that arises from the adrenal gland. And I'm not going to get into it, but that's all you need to know. It's a tumor that arises from the adrenal gland. Okay, next one is neuroblastoma. This is also a tumor of the adrenal gland. Know that this one mainly affects children. Kind of common, this one.
Means nobody can lose it? Or just-
No, you don't, unless you want to. Okay, next we're gonna talk about the pituitary gland. Know the other name, like I said, master gland, hypophyseal gland. Where's the pituitary gland? You guys remember?
In your brain,
Where in your brain?
in the middle.
What bony structure's in the middle? Cella-turcica. Sits in the cella-turcica of the brain.
What was the other name? Was that
Hypophyseal. Hypophyseal. Okay, diseases of the pituitary gland. Hyperpituitarism, which is excessive secretion of the growth hormone. Okay, two main types if it's hypersecretion is gigantism. This is before bone growth has stopped, so it's in children. Okay, it just results in a large skeleton. Okay, acromegaly, this is hyperpituitarism after bone growth has stopped. First one was before, this is after bone growth has stopped, so this is in the adult. And it just results in thickening of the skin. They have big fat pads, like their heels are huge. Just know that it's basically known as after the bone growth has stopped, so it's in the adult. Okay, that's it for pituitary. We're gonna go to thyroid gland. Where's the thyroid gland? Good. The thyroid gland is in your neck, about the level of the larynx. Okay, diseases of the thyroid gland. Hyperthyroidism, which would be excessive production. Two main causes. Number 1 from an adenoma, which is a tumor. And the second type is called Graves' disease. And this is excessive production from the thyroid itself. Make a star by that. I see Graves' disease on a lot of registry review stuff. Okay, so the first one is excessive production because of a tumor. And the second one is because of the thyroid gland itself, Graves' disease. All right, hypothyroidism is the next thing. This is insufficient production. First one is known as cretinism. This is hypothyroidism dating from birth. So this is the children. And there's an adult one too, which I didn't put on your handouts, but don't worry about it. Okay, radiographic appearance for children, it's delayed bone growth. And for adults, if I don't put it down, you need to write it down. They usually have an enlarged heart if it's hypothyroidism. Okay, if I have goiter,
You still have to write out the difference between child and adult.
you have radiographic appearance, you have to know the difference. If I have goiter on there, it's not on your test. You guys know what a goiter is. Just, okay, pancreas is the next, pancreatic disorders. First one is diabetes mellitus. This one is when the pancreas fails to secrete insulin and or the target organs or cells fail to respond to insulin. Okay, I don't know if I put this down about insulin. If I didn't, go ahead and write it. Insulin, it acts like a key to open most cells. Is it on there? So go ahead and write it out. Insulin, it acts like a key to open most cells to allow glucose to enter and give it energy. To open up the cells, and that way it allows glucose to enter and give it energy, the cell energy. So if there's a lack of insulin, glucose can't get in the cell. Okay. That results in excessive glucose in your blood system. And they call that hyperglycemia. Hyper, too much glucose, hyperglycemia.
Is it hyper?
Hyper, with an ER, hyper. Too much glucose in your blood. Okay, you need to know the two types of diabetes mellitus. There's another type of diabetes insipidus, and I didn't get into it in case you're wondering. Don't worry about it. Okay, diabetes mellitus. Type 1 is known as juvenile onset. So just like it says, it develops in the child. Type 1. These patients are insulin dependent. They're the folks that usually have to do an injection. Now there's different types where it's twice a year or twice every 6 months or something. But anyway, they're insulin dependent with injections. Type 2 diabetes is maturity onset, which means it usually happens in the adult. It's usually less severe. And how do they control, or how, besides medicine, but how do they control, type 2 diabetes?
Type 2 by diet.
By diet. They tell the patient to lose weight. Okay. So they control type 2 mainly by diet. Okay, on your handout also, I went into insulin shock. Okay, so you need to know insulin shock is hypoglycemic shock. And diabetic coma. First of all, insulin shock is where they have too much insulin, in case you didn't know. Diabetic coma is when the patient doesn't get enough insulin. Okay, you're gonna have to name 3 signs for each one. Okay, so under diabetic coma, I put down like 4 signs. Labored breathing, skin and tongue is dry. There's a fruity smell to the breath, and the patient is lethargic, sometimes comatose.
How many do you have?
You have to name 3 for each type. Okay, that's the bad one, diabetic coma. The patient needs insulin right away with the diabetic coma. Okay, insulin shock is too much insulin. Sometimes they don't eat well, not enough to eat. The signs for those: patient is lightheaded or faint. The patient trembles and perspires sometimes. Okay. For these people, the patient needs some type of sugar, whether it's orange juice or glucose tablet for that. Okay, don't worry about radiographic appearance. Okay, miscellaneous diseases, we're almost done. Okay, the first one is scurvy. Sorry about the pirates getting me all the time. I was thinking of those old movies. But anyway, scurvy is a deficiency of vitamin C. So usually people that don't get enough fruit or vegetables. That's all I want you to know. Next one is something called systemic lupus or erythematosus. Know the other name for it. This is a connective tissue disorder. Primarily involves young or middle-aged women. Lupus. And I didn't get into all autoimmune disease. Don't worry about that. Okay, next thing is melanoma. Know that the melanoma is highly malignant skin cancer. Sometimes it does metastasize within your body itself. Muscular dystrophy, I did not put on your test. Marfan syndrome. Okay. Marfan syndrome is an inherited disorder. There are skeletal and cardiovascular signs with Marfan's. Those are the folks that are really tall and slender. A couple basketball players had the disease. And almost all patients with Marfan's have a cardiac condition, usually an enlarged heart. That's why they have to watch them very carefully. Okay, the next one is something new. Hate to tell you this, but at least one of you are going to have this on your registry. Okay, so know this disease. It's called Legg-Calvé-Perthes disease. It is a childhood condition. The femoral head dies because for some reason there's lack of blood going to it. Know the radiographic sign. It's not on your test, but I'm telling you to know this one. Okay, the radiographic sign is flattening of the femoral head.
Is the disease intense though?
The disease is not on this test coming up, but do not forget this disease. Okay, the next one is internal devices and placement of that. It's going to be on your test. I did make them extra credit. We've had this before, it's kind of a review. Okay, first one is an endotracheal tube. What's an endotracheal tube? Yeah, it's for breathing, okay. So know that the tip of it is 5 to 7 centimeters. When I say tip, I mean the bottom of it, okay. The tip of it should be 5 to 7 centimeters above the carina. Pardon me? 5 to 7 centimeters above the carina. All right, the second one is called, I think a lot of this is on your portable comp, central venous catheter or CVP line. And it's just what it says it does. It measures central venous pressure. The tip of this one should be in the SVC, superior vena cava.
So superior vena cava?
Yes, the tip of it should be in the SVC. Okay, the next one is a PIC line, which stands for peripherally inserted central catheter. Where do those start? Good. They start in your arm somewhere. Okay, this one is for long-term venous access. They have to keep giving them drugs. Where should the tip of that one be? Good. Tip of that one is in the SVC as well, superior vena cava. Okay, Swan-Ganz catheter is the next one. It measures pulmonary pressure, basically. A couple other things too. The tip of this one should be in the right or left pulmonary artery. Right or left, doesn't matter. Pulmonary artery. Right, so the pulmonary artery contains what type of blood? Venous, don't forget that. So you guys got that wrong on your test. Pulmonary artery has venous blood.
It's the only artery with venous blood.
Basically, yeah. So where does the, just trying to get you the thing, where does the pulmonary artery come off of? Which ventricle?
Right.
Good, the right ventricle. All right. All right, the last one is the transvenous cardiac pacemaker. It is a temporary pacer. The tip of it should be in the apex of the right ventricle. Where do they put the permanent or semi-permanent pacemakers? They don't go in venous. Where do they go? Just under the skin. There are those big boxes under the skin.
You said the tip should be where?
The tip of it should be in the right ventricle, apex of the right ventricle.
That's where the contraction starts.
There you go, the Purkinje fibers. All right. Any questions?
Was this last part matching?
It's extra credit. You need to know where they end, basically, the tip. Are you guys, other than the next test, remember you have that outline that you have to turn in by April
Yeah, the
28th?
science con. Science con.
Yeah, you have to do the outline. Basically, that's it for me. I don't know if I told you guys, but we had some extra money that I had to spend, so I purchased, RadTech Boot Camp for you guys. I'll send you all the information within the next couple of days. It's just in the process of being purchased. We just put out the purchase order. So it's really helpful, that RadTech Boot Camp for you, for studying registry review stuff.
What was the name of the other one?
Rad Review. Rad Review is more, ART review. RadTech Boot Camp is more of a, they have lots of videos.
So,
It's good for the science stuff that you guys are kind of weak in.
you think the registry gonna be like more scenario type questions or like more like facts?
No, they're more facts,
More facts?
yeah.
Okay.
They're multiple choice, but sometimes they're multiple choice. You have to choose the best answer.
Mhm. Okay.
If you guys, we'll have to talk about meeting or something, cause basically I don't really have you guys at all. I'm gonna try and set up a final, I guess we can do it then. I'm gonna try and set up a final competency for you guys, whether it's positioning. Did we ever do it? Did we ever do positioning comps? We did.
Yes.
Okay, so we did them in the fall. Okay, remember when you guys picked something out of a hat, you went in there? I'm gonna try and do that, if I can.
I should remember.
I'm not gonna give you a written test, but I am gonna do a, image test for you guys, and I'll go over that more, probably via email. And I'll pull you from clinical, and I'll let you know the days that I'm gonna pull you from clinical. You guys might wanna think about, a partner that you might want to have for your positioning stuff.
What are we positioning? Anything?
Anything, I have the list, well, anything that we learned so far. So upper extremity, lower extremity, chest, abdomen, and spine. Those would be the categories.
Did you say there's not an imaging comp? It's just.
I'm not gonna give you the written test. I might,
So you're saying we're not gonna see you next semester?
okay, next semester is online, it's, registry review, which,
There's, I have brought my books from one of the seniors, and there was that Q&A question book that you gave me. And then Ronnie asked the other day if you had that.
the Lang book,
Yeah.
the RAD review is Lang. It's just the software, the website,
Okay.
but that's Lang, that's from Lang.
Okay.
Okay, and I did make out different tests, and I'll give you guys the syllabus for next semester, and it says exactly what to do. First, do positioning, and I give you I'm sending you little cheat sheets. In fact, I have them printed out, cause I like a hard copy, but I'll send it to you via, Canvas, but I also have the hard copies too, which I guess I can give you guys right now.
What were you saying, like we have to have the science, our science comp outline?
Yeah, I gave you an outline, and you have to fill in the different bullet points.
Oh, okay.
Email it to you?
Yeah, just email it to me. I think it's due April 29th, I put down, and 28th,
And the outline is on Canvas?
yes,
Okay.
yeah. And that, the science comp that I did throughout the whole 2 years that you guys were here, or however I did it, I don't remember when COVID started, but anyway, that is exactly by the ART content specs. Yeah, I told you guys, make sure you print out those content specs and go over everything in the content spec. If you don't know what it is, you need to look it up. All right, because it's telling you exactly what's gonna be on the registry. All right, okay, I'm gonna go get those hard copies of the stuff I'm gonna send you next semester, just because the next time I see you, it's just for a test. Then I won't see you at all. So, if you have any questions, if you guys ever want to meet on campus, let me know.
Do you know, anything about Terry's class for, the summer?
I know it's a lab. And it's a quality assurance lab, and yeah, it's gonna be in person.
It's split into two classes. on Monday,
Yeah,
but it's two classes one after another, so I think it's.
Will you be here, like, for office hours, anything during that time?
I don't plan to, but if you guys want me to, I can certainly.
Well, I want you to come, we're planning on it, we're just wondering, I was wondering, will we see you then, I guess? Or is this literally probably the last time we might see you?
Cause you guys, well, besides the comps, probably, yeah. Besides the next time you take the next test.
The positioning, is that this semester or next semester?
Next semester, and I'll give you more information via email. But think about a partner that you'll want to have,
Okay.
and I'll send you out all this stuff. And the images will be all the images, not all of them, there's like 20 of them that we've been over, and I'll tell you about them. Everything except for special procedures.
Okay.
So like, one of the hand, one of the wrist, that kind of thing.
Gotcha.
Okay. All right, let me go. Did you guys all sign this?
Yeah.
True.
I did.
You did? Okay. All right, let me go get those cheat sheets.
Ooh.